Richard walked into my clinic looking terrified. 67 years old, successful architect, couldn't remember his grandson's name.
I see this fear in Tokyo, too. But here's what surprises Americans.
His wife said he'd ask the same question 3 times in 10 minutes. Classic early warning sign.
In Japan, families notice these changes years earlier. We don't wait for crisis.
I ran the full cognitive battery. MRI showed hippocampal atrophy, exactly what I expected at his age.
And you prescribed medication?
Not immediately. I told him something that shocked him. Your brain has been shrinking since age 30.
This is where Western medicine waits too long. We teach prevention at 40, not treatment at 70.
Here's the brutal truth. After 60, you lose 0.5% of brain volume every year.
But Okinawa seniors at 85 have cognitive function of American 70-year-olds. Why?
Akira, I need data, not anecdotes. What's the mechanism?
The mechanism is living correctly for 40 years before symptoms appear. You can't pill your way out of decades of damage.
Fine. Let's talk about what actually works. The hippocampus, your memory center, shrinks fastest.
And it responds to 3 things Japanese elders do daily: movement, connection, purpose.
Movement I'll accept. Aerobic exercise increases BDNF, brain-derived neurotrophic factor. It's like fertilizer for neurons.
But your patients do intense gym workouts. Mine walk to the market, garden, stretch. Gentle, daily, lifelong.
There's actually research supporting that. High-intensity exercise after 60 can spike cortisol, which damages the hippocampus.
Exactly. The body is wise. It tells you gentle is better.
So what did I tell Richard? 30 minutes of walking, every single day. Non-negotiable.
Good start. Did you ask about his sleep?
5 hours a night. Retired, but stayed up watching news until 2 a.m. Classic mistake.
This is where your brain cleans itself. The glymphatic system. It only works during deep sleep.
Right. During sleep, cerebrospinal fluid washes out beta-amyloid plaques, the same plaques that cause Alzheimer's.
So 5 hours of sleep means 5 hours of cleaning. Not enough.
I prescribed 7 to 9 hours, period. That's the clinical recommendation.
Here's where we disagree. Japanese elders sleep 6 hours at night, then 20 minutes in afternoon. Total rest time matters more than 1 block.
Show me the study on afternoon naps preventing dementia.
I show you Okinawa. Lowest dementia rates in developed world. They all nap.
Correlation isn't causation, Akira. But fine, I told Richard to prioritize sleep however he could get it.
Did you check his social connections?
That's not typically part of my cognitive assessment. I'm a physician, not a therapist.
And this is why your patients decline faster. Loneliness shrinks the brain as much as not sleeping.
Actually, the Framingham Heart Study supports that. Social isolation increases dementia risk by 50%.
50%? That's more than most medications can help.
So I asked Richard. Turns out, after retirement, he stopped seeing his old colleagues. Wife was his only regular contact.
Classic Western retirement problem. In Japan, elders join community groups, volunteer, teach young people. They have purpose.
Purpose. That's harder to measure than hippocampal volume.
But you can see it. Richard had no reason to remember names. No one to share memories with.
Fair point. The brain is use it or lose it. Neurons that don't fire together don't wire together.
So what happened with Richard?
I'll tell you in a minute. First, let's talk about what you're eating, because diet matters more than most people realize.
Oh, here we go. You'll say, Mediterranean diet, omega-3, antioxidants.
Because those are proven. Mind diet reduces Alzheimer's risk by 53% in compliance studies.
And Japanese elders eat fish, seaweed, fermented foods. Same result, different tradition.
The common factor is omega-3 fatty acids, DHA specifically. It's 60% of your brain's dry weight.
Which most Americans don't get enough of.
Correct. Average American gets maybe 200 milligrams daily. You need at least 1,000 for brain maintenance.
But you don't just prescribe pills, right? You teach them to eat actual fish?
I recommend 3 servings of fatty fish per week: salmon, mackerel, sardines. Food first, supplements if needed.
Good. And berries?
Blueberries especially. They contain anthocyanins that cross the blood-brain barrier and reduce oxidative stress.
Same compounds in purple sweet potato we eat in Okinawa.
See, we agree more than you think. The science backs up traditional wisdom when the mechanisms are there.
Then why do American doctors wait until memory problems appear?
Because our system isn't built for prevention. We treat disease, not health. I hate it, but that's the reality.
Which is why your Richards come to you at 67 instead of 47.
Exactly. But here's what I can do. I can give them a protocol that works, right now, regardless of age.
I'm listening.
Step 1. 30 minutes of movement daily. Walking, swimming, tai chi. Gentle, consistent, lifelong.
Agreed. Step 2.
Sleep 7 to 9 hours, or 6 plus a nap if that's your pattern. Total rest time matters.
See, you're learning. Step 3.
Eat for your brain. Fatty fish 3 times weekly, berries daily, leafy greens, olive oil. Mind diet basics.
Step 4 is social connection. Talk to humans, not screens.
Yes, join a club, volunteer, teach something. Your brain needs other brains to stay sharp.
And step 5, purpose. Find a reason to remember.
That one's harder to prescribe, but Richard found his.
Tell me what happened.
6 months later, he came back for follow-up. Different man, walking every morning with a retired engineer friend.
The social connection piece.
He joined a community architecture group that reviews new building proposals, uses his expertise to help the neighborhood.
There's the purpose. He has a reason to remember technical details, neighborhood names, meeting times.
And he's sleeping 8 hours now, started eating salmon twice a week, added walnuts and blueberries.
How's his memory?
Cognitive assessment improved 12 points. That's significant. Not back to 30-year-old levels, but functional and improving.
And no medication?
None. Lifestyle intervention only, which proves your point, Akira. Prevention works better than pills.
This is what I've seen in Japan for decades. The body knows how to heal when you give it what it needs.
Let's be clear, though. Richard caught it early. If he'd waited 5 more years, lifestyle changes might not be enough.
Which is why people watching this need to start today, not next year.
Agreed. Now let's talk about the habits most people get wrong, starting with supplements.
Oh no, here comes the American pill obsession.
Wait, I'm going to surprise you. Most brain supplements are useless.
Really? You're admitting this?
The research is clear. Ginkgo biloba doesn't work. Prevagen doesn't work. Most nootropic blends are marketing, not medicine.
Text_16.
Most don't, but 3 do. Omega-3 if you're not eating fish. Vitamin D if you're deficient. B-complex for methylation.
These are nutritional deficiencies, not brain boosters.
Exactly. You can't supplement your way out of a bad lifestyle. Food, sleep, movement come first.
Now you sound Japanese. I'm impressed.
Let's talk about screen time. This is the new smoking for brain health.
Finally, something we fully agree on.
Passive scrolling reduces hippocampal activity. Your brain goes into default mode, stops creating new memories.
And it replaces real conversation. Remember, social isolation is 50% higher dementia risk.
So here's my rule for patients over 60. 1 hour maximum of recreational screen time daily.
That includes TV, phone, computer, everything that isn't active learning.
Right. Reading, online courses, video calls with family don't count. I'm talking about passive consumption.
What should they do instead?
Anything that requires active thinking. Puzzles, learning languages, teaching skills, having debates. Real cognitive load.
In Okinawa, elders teach traditional crafts to children. Keeps their minds sharp, explaining complex techniques.
That's brilliant. Teaching forces you to organize information clearly, which strengthens neural pathways.
And gives them purpose, social connection, and cognitive challenge. 3 brain protectors in one activity.
Now let's address stress. Chronic cortisol elevation literally shrinks the hippocampus.
And Americans are the most stressed, developed nation.
Sadly true. We work longer hours, retire later, have less community support. It's a brain health disaster.
In Japan, we practice small, daily stress releases. Not one big vacation per year.
Like what? Give me practical examples.
Morning tea ceremony. 20 minutes of complete presence and calm. Resets cortisol before the day begins.
Americans would call that meditation. Same mechanism, different cultural frame.
Exactly. Mindfulness reduces amygdala reactivity and increases prefrontal control. The research backs traditional practice.
So what's the minimum effective dose? How much daily practice to see benefits?
10 minutes. That's it. 10 minutes of quiet breathing reduces cortisol by 20%.
I can prescribe 10 minutes. Most people waste that much scrolling anyway.
Exactly. Morning routine should be meditation first, phone last.
Now here's something controversial. Alcohol. Even moderate drinking accelerates brain aging.
You're going to make people angry with this one.
I don't care. The UK Biobank study tracked 500,000 people. Even 7 drinks per week showed measurable brain shrinkage.
But Western culture celebrates wine with dinner, cocktails at events. Hard message to sell.
Truth isn't a popularity contest. If you want to protect your brain, minimize alcohol. Period.
In Okinawa, elders barely drink. Maybe small sake at celebrations. That's it.
And they have some of the sharpest minds at 90. Coincidence? I think not.
What about coffee? Americans drink gallons of it.
Coffee's actually protective. 3 to 4 cups daily reduces Alzheimer's risk by 27%.
Because of caffeine or antioxidants?
Both. Caffeine blocks adenosine receptors that contribute to neurodegeneration. Plus, polyphenols reduce inflammation.
But not after 2 p.m. Ruins sleep, which ruins everything else.
Correct. Morning coffee, yes. Evening coffee destroys your glymphatic cleaning at night.
Let's talk about hearing. Most people don't know this connection.
Hearing loss doubles dementia risk. Untreated hearing loss forces the brain to work harder just to understand conversation.
And that cognitive load exhausts the brain, leaving less energy for memory formation.
Plus, people with hearing loss withdraw socially. Can't follow conversations at restaurants, so they stop going. Double hit.
So hearing aids are brain protection, not just ear devices.
Exactly. If you're over 60 and struggle to hear in noisy environments, get tested. Don't wait.
What about blood pressure? You Americans love measuring numbers.
High blood pressure in midlife increases late-life dementia risk by 60%. Your brain needs clean blood flow.
And how do you control it without just pills?
Movement, stress reduction, less salt, more potassium. The same lifestyle habits that protect your brain, protect your heart.
Everything connects. This is what holistic means.
All right, let's give people the 90-day protocol. Simple, actionable, proven.
5 non-negotiables. Starting tomorrow.